Welcome everyone. We're diving into pediatric dentistry essentials today, talking about how to keep our little ones' smiles bright and healthy.
Absolutely. It's amazing how early dental care sets the stage for a lifetime of good oral health.
Right, so one of the big things is the timing. Kids should see a dentist by their first birthday or within 6 months of their first tooth showing up.
Understood. That does seem early, but it makes sense given how important those baby teeth are.
Exactly. Even though baby teeth eventually fall out, they are critical for chewing, for speech development, and even for guiding the permanent teeth into the correct place.
Yeah, it's like these tiny teeth are actually tiny scaffolds for a child's future dental structure, right?
Exactly. And prevention is key. Brushing twice a day with fluoride toothpaste, avoiding sugary snacks, and of course, regular dental checkups every 6 months go a long way.
Yeah, that routine sounds solid. Speaking of toothpaste, there's always a question about when to start brushing and how much fluoride to use, isn't there?
Right, and the guideline is, as soon as the first tooth pops up, you start brushing. Use a soft bristled brush with just a rice-sized amount of fluoride toothpaste, which is, just enough to prevent those cavities without overdoing it.
I get that, but honestly, sometimes it feels too precise. Like, can a little extra paste be harmful?
Well, there is some debate, but the key is balance. Too much fluoride can be problematic, yet too little might not fully protect the enamel. It's a fine line
makes
for
sense.
sure.
And what about dental sealants? They seem like a pretty neat option for cavity prevention, right?
Absolutely. Dental sealants are thin protective coatings applied mainly to the back teeth to keep cavities at bay. They're typically recommended for kids aged 6 and up when the molars come in.
That essentially is like adding an extra layer of defense to those vulnerable chewing surfaces.
Exactly. It's like icing on a cake that guards against decay.
Now moving to emergencies, what should a parent do if a child's tooth gets knocked out?
Good question. The advice differs for baby teeth versus permanent teeth. For baby teeth, you don't reinsert them. You just need to get to a dentist quickly. For permanent teeth, though, you should keep the tooth in milk or saliva and see a dentist without delay.
Right, immediate action is key. It's really interesting how the handling is so different between the two types.
Yes, the approach is tailored. Baby teeth aren't meant to be reimplanted since they're temporary, whereas permanent teeth need every chance to be saved.
Speaking of habits, there's a lot of concern about pacifiers and thumb sucking. What are your thoughts on that?
Well, pacifiers and thumb sucking are generally not harmful if they stop by around age 3 or 4. Beyond that, they can lead to misaligned teeth or jaw problems.
That extra year or so can really make a difference. Yeah, but some parents do argue that these habits are natural. Do you think the risk is really high?
I respectfully see it as a risk that increases with duration. Early intervention using positive reinforcement can help stop thumb sucking, and a dentist can suggest habit-breaking devices if
Yeah, that
needed.
seems like a balanced approach. For sure, it sounds like consistency and early familiarity with dental visits really make a difference.
Absolutely. Regular visits, ideally every 6 months, not only help in catching issues early, but also help kids get used to the dental environment, making visits less intimidating.
Right, and that early exposure really helps them form a positive relationship with the dentist.
Exactly. Plus, there are some great strategies to ease any anxiety, like using positive words about the dentist, showing books or videos that portray friendly visits, and even setting the tone with fun stories.
Those tips definitely sound effective. I also found it interesting that sometimes permanent teeth might grow behind baby teeth, a phenomenon sometimes called shark teeth. What do you make of that?
Yeah, that's a curious case. It's usually normal and corrects itself once the baby teeth fall out, though a dentist should always evaluate if the baby teeth are stubbornly staying put or misaligned.
So it's more of a watch and wait situation unless complications arise?
Precisely. Keep an eye on things, and if it doesn't resolve naturally, an evaluation can prevent future misalignment issues.
And speaking of misalignment, what do we say about braces?
If a child has crowded or misaligned teeth or bite issues, an orthodontic evaluation is recommended by age 7. That doesn't automatically mean braces, but it sets the stage for future intervention if necessary.
Right, early assessments can really prevent bigger issues later on. Agreed. And moving to cavities, yes, even baby teeth can get cavities, which is not something parents should ignore.
Definitely. Cavities in baby teeth are serious because untreated decay can lead to infections and affect the development of permanent teeth.
You'll want to nip that in the bud.
Absolutely. So prevention is definitely the theme here. Good brushing habits, limited sugary snacks, and timely dental visits.
And what about diet? Are there specific foods that help promote strong dental health in children?
Yes, foods rich in calcium and vitamins play a critical role. Dairy products like milk, cheese, yogurt are top picks. And then fruits and vegetables such as apples, carrots, and leafy greens help too. Even lean proteins
Right on,
and
a
nuts
balanced
can
diet really is
contribute.
key. This all really ties back into the overall picture of holistic care, dental hygiene, regular visits, proper nutrition, all working together to keep those smiles shining.
Exactly, it's all integrated. And while teeth whitening may sound tempting, especially considering today's beauty trends, it's important to note that it's not recommended for kids
Better
under
safe
16.
than sorry with that one. Overall, it's evident that early dental care not only ensures immediate health, but lays the groundwork for long-term dental and overall health.
Absolutely, as parents, ensuring these habits early on builds a foundation that can support a lifetime of, healthy smiles.
This has been a great deep dive into pediatric dentistry, really covering the essentials with a clear, actionable focus.
It sure has. And I hope these insights help simplify decisions for parents and caregivers everywhere. Thanks for joining in on this enlightening conversation.
Thanks for the chat. Always a pleasure to break down these important details together.